How long does menopause last? And how long do menopausal symptoms last? Those are two different questions. I'm going to answer them both. They have different answers. Guys, I'm Dr. Jen. Let's first start by defining what menopause is. Menopause is the period of your life where you've gone at least 12 months without having a menstrual period. Okay? Menopause is not before then. If you're still having a period, if it's irregular, whatever, that's not menopause. Menopause is when you've gone at least 12 months without a period. Okay. The average age of menopause is around 51, 52, something like that. All right. Now, remember, surgical menopause can be triggered by surgery. If you have a hysterectomy or a surgical removal of your ovaries, that can put you into menopause. But we are talking about sort of the change in life, okay? And that is defined by no period for 12 months. Okay, good. Got that. Now let's talk about the period, no pun intended. Let's talk about the time before you technically go into menopause. That's perimenopausal, okay? Perimenopause, or the menopausal transition, that's another word we use for it, generally starts around the age of 45, but it's different for everybody. The range actually can be anywhere from like 45 to 55-ish, where women start the transition to going towards menopause, that period where you have 12 months without a period. What happens during perimenopause, peri meaning around menopause, right? That's what happens before, is your body is changing. Your hormones are changing. You have a decreased level of estrogen. Your body, sometimes it may feel like it's a little out of whack. And there are a number of symptoms that can come along with this time period. Things like hot flashes, mood changes, problems sleeping, vaginal dryness, problems with urination, urinary tract changes, irregular periods. There's a number of symptoms. There's even more. Now, some people, when they're perimenopausal or in the menopausal transition, don't experience any symptoms or might only have one or two, whereas other people may have a whole bunch of them. They might be severe. It's going to be different for everyone. And again, the general range for perimenopause or the menopausal transition is 45 to 55, okay? Now, that leads up to becoming menopausal or going into menopause. And once again, I keep repeating myself because I think it's important to make sure that you understand the timeline. Menopause is then when you haven't had a period for 12 months or longer, okay? Now, let me answer the question of how long does menopause last? Well, technically, menopause lasts for the rest of your life. Once you get through perimenopause, the menopausal transition, and you become menopausal, you haven't had a period for 12 months. You're in menopause, also called postmenopausal. You're in that for the rest of your life. That status does not change. You are postmenopausal, okay? However, I think a lot of times we're asking about the symptoms. You may be wondering, how long do the symptoms of menopause last? So now let's focus on that. Okay, I mentioned when we're in perimenopause, the period. Keep saying the period before the period. It's a little the time. The time before we become menopausal. Those symptoms can be hot flashes, mood changes, period changes, et cetera, et cetera. Well, those symptoms can, especially for the more common ones like hot flashes, studies have shown that hot flashes can last anywhere from like 7 to 11 years. However, for some women, those hot flashes last even longer than that. For some women, it's less than that, okay? So some women will start those symptoms in perimenopause and will have like hot flashes into menopause and maybe even into their 70s, 80s potentially. Now, vaginal dryness, many report that vaginal dryness is something that may last forever. Many of the other symptoms, though, so there's many women who may only have these symptoms, whether it's hot flashes, problems sleeping, et cetera, they may only have them for 6 months and go away. Okay, so you see here that there is a range, number one. There is sort of an estimate of about 7 to 11 years, especially for hot flashes, that they may last, but they can last longer, they can last shorter. And some symptoms may be more likely than others to last for the long haul versus others for the short haul. And then the bottom line, of course, is that, it's just going to be different for every woman. There's women out here who've never experienced a hot flash in their entire life, never had problems sleeping, et cetera. And then there are some women that really struggle with it, okay? So it's really, really individual. What I do want to let you know is that there are treatments, and there are, and by the way, I have videos on menopausal symptoms, so you can sort of look more into those, and also potential treatments for hot flashes and things like that. But there are potential treatments. You want to talk to your OBGYN, your family doctor, whoever does your women's care, You want to talk to them about potential treatments. You want to talk to them about how these changes are affecting your life, because oftentimes there are things we can do. Now, we can't always do something, but sometimes we can. So I do want to give you hope. And the other thing is, what I would do is, take some of this information and any other information you're pulling and go into your doctor and have a conversation about, again, what's happening with you. Just keep in mind that, being in menopause is something you will be in for the rest of your life, but it doesn't mean that you will have to have menopausal symptoms, the symptoms of menopause for the rest of your life. In fact, many people do not. And the average age for symptoms like hot flashes is like 7 to 11 years. That can be different for every woman. Okay. So I hope this is helpful. Let me know what you think. Let me write in the comments. Tell me what's going on with you, what you've experienced, what you do. Oftentimes what you write helps other people, and I imagine it will here too. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on Facebook. Please like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates as well. I'm on TikTok and WhatsApp and Instagram, etc. at Dr. Jen Caudle. And go to my website, drjencaudle.com, to sign up for my free health newsletter. Guys, I hope this is helpful.